New noise to tell us that we're live, I think. Hi, everybody. Welcome to Inside Scoop with Sue. And today I'm so excited to be back with Dr. Anisha Abraham. Thanks for being here. This was very tightly fit between a busy schedule. So let me just tell you a little bit that Dr. Anisha Abraham is a pediatrician who specializes in teen health, which is great because that's what we talk about, and also the author of Raising Global Teens. So our topic today is, I wrote down debilitating menstrual cramps, but there's probably a whole spectrum of times where you should jump in and do something before it's completely debilitating. Is that true?
It is. And thank you again, Susan. It's wonderful to be back on the show. I'll just say that having painful menstrual cramps, or the other word for that is dysmenorrhea, is a fairly common issue that we see with young people, but no one needs to suffer. And certainly, whether it's mild all the way to severe, there certainly are many different things that we can do to address it and make sure that young people can get back to school, their activities, all the things that they need to do.
Well, so how about we start with that? Tell us what some of the things are that people can do. And then I'm going to share some of the things that parents have posted when the question was asked on our Facebook group about my daughter has terrible period cramps, and just kind of check in to see whether they're on the mark or not. But if you could tell us, what are the best practices to start with?
Well, I will just start by saying that painful periods are very much related to uterine contraction. So again, the muscles of the uterus are contracting and releasing during the time of menstrual cycle, and that a chemical is released called prostaglandins, and those can actually cause severe pain, cramps, nausea. And that's also the same chemical that's released during labor when you're having a baby. So you can imagine how much, that can hurt. And so again, maybe being able to address that, I think, is really important. A lot of times the first line of treatment, if someone were to come in and to say that they're having severe pain, nausea, would be to start something called a non-steroidal anti-inflammatory, big word for something like ibuprofen. And again, a lot of young people will say, well, I tried that and it didn't seem to work. And I think the important piece is that you need to do it with some regularity to really decrease that the prostaglandin release. And so making sure that you take one tablet every 6 to 8 hours, starting even before you have your menstrual cycle, would be really important. So that is certainly something you can consider doing. It's
So
also,
let me ask you something, because
yes,
some of
yeah,
the people posted that their kids were using Aleve.
right.
Let me just answer this question. They're asking if it will be recorded. It's being recorded right now. So as soon as this is over, you'll be able to watch it either on our Facebook channel, LinkedIn, Twitter, and YouTube. So you guys got it afterwards. So is there that came up much more than any other painkiller? Does that offer more relief?
Certainly, Aleve, which is also known as naproxen sodium, is a stronger version of a nonsteroidal, and it can be a very good method to decrease pain with periods. The recommendation, of course, is to take it with food. You should not take any of these nonsteroidals on an empty stomach, and to make sure that you are taking it pretty regularly. As I mentioned, starting in a day or two before you have your periods, and then continuing it for a couple of days while you continue to have pain would really be helpful. But whether it's ibuprofen at a fairly high dose or Aleve, as you mentioned, those are all great first lines in terms of really helping with painful periods.
Okay, and Carrie wants to know, is Midol, where does that fit in?
Midol also can certainly be another choice that you can potentially use in terms of helping also with painful periods. So these are all great first lines. I will also add that I'm asked quite often, what else can you do other than taking medication? And just again, thinking about the fact that you're thinking about contractions of the uterus, anything to relax that. So exercise, if you can, actually can really help with relaxation. Yoga, any kind of relaxation techniques. These are all really wonderful things that you can also add on. Using a heat pack can be very helpful during that time. So these are other things to add on in addition to some of the medications that we've just talked about.
So there was something about, and you mentioned it also, like getting this started before the pain starts. But if you have erratic periods, you might not know when you're going to get your period.
Absolutely. So a lot of young women that I work with don't exactly know when they're having their periods. They can be a little bit more erratic. And I will say that trying to use a period or a menstrual tracker and actually tracking your periods can be very helpful to know whether or not they're really happening every 3 to 5 weeks, which is actually kind of the normal time period that young people should have periods. And to make sure that their periods aren't happening more frequently or less frequently can be really helpful. And certainly giving you some sense as to when those periods could be occurring so that you can start to time these non-steroidals. So my recommendation is try to start tracking periods. There's wonderful apps that are available on phones and other devices to be able to do that. But if you truly are having irregular periods and you're having a lot of pain, it may be a time to also talk to your health professional to talk a little bit more about other methods that you can take more continuously to help with that pain.
Okay, so should you start with your pediatrician, your primary care doctor, or do you go right to the gynecologist?
That's a great question. And I really do think it depends on whether or not your primary care feels comfortable taking care of these issues. As an adolescent medicine specialist, we certainly will take care of these concerns. A lot of primary care physicians can too as well. So I don't think you need to go straight to a gynecologist unless it, again, is something that's fairly complicated. I will also add, and I know this is a question that's asked quite often, what can I do if I've already tried nonsteroidals? It doesn't seem to help. I've really optimized it. I've done it several days before my periods. I've really tried to time and track my periods. And I will say that there are other medications in addition to the things that I mentioned, like yoga and exercise and heating pads. And many times physicians may recommend using hormonal methods to also decrease some of the pain that is associated with menstrual cycles. And those include things like being on hormonal contraceptives. So some of you may think about that as the regular pill, but I'll just mention there's a lot of different formulations that are out there. So whether it's the pill or the patch or the ring, or even potentially using something like an intrauterine device, some of these things can also very much help young people with some of the things that they're experiencing.
What would be the pushback? Because I know people are worried about putting their kids on hormones. So what's the response to that kind of pushback?
And I have to say, these are very individual discussions that each young person and their family need to have with their healthcare provider. This is not going to be what fits for every single person, but I certainly have young people that are missing so much school activities or work. It's very debilitating for them when they're, struggling with these kind of issues and they're taking perhaps just the nonsteroidals, that's kind of the point where they decide that being on something that can decrease that pain from a hormonal standpoint that affects estrogen and progesterone may be much more effective. And again, I can't say this is uniformly what everyone wants. I think some parents are worried about starting these things. I will also say it doesn't need to be lifelong. It may be a short-term measure just to kind of get them through that point and see how things go. But I've had young people that have really had some benefit from being, for example, on the birth control pill to help regulate their periods and decrease, again, that chemical release and to decrease, the pain, nausea, all the other things associated with it.
Okay, so there are comments around this one topic, which is my kid was depressed when they were on birth control. So we should be careful, right? Like we have to be watching for everything we try.
Absolutely. And I will just say that there are many different formulations of the birth control pill that are out there. And there, of course, are birth control methods that don't contain estrogen, particularly for people that have migraine headaches or auras or other things. So there's many different formulations that are out there that we can try. It's hard to, of course, know if mood alone is associated with the pill or if there's other things that are going on. And that's why, again, I think it's really important to have these individual discussions with your provider about what's the best formulation for them, which would have the least amount of side effects and potentially not cause any kind of mood issues, because we certainly don't want to add to young people's level of stress or depression or mental health issues that are going on.
Yeah, they've got so much going on already. We don't want to layer it on, right? Okay, this one I never heard, and I hope there's some truth to it, but someone said that menstrual cups help their kid.
That's an interesting question. And I do know that some of my young patients are using menstrual cups. That's a device that is inserted into the vaginal area and it collects menstrual fluid. Certainly, some people have said that potentially is more ecologically friendly. You're not using pads or tampons. Others think that, again, is something that you can, potentially use to actually have a good sense of, your flow. And it seems to for some people really make a difference. And looking at the literature, again, I'm not so familiar with whether or not this really decreases pain and dysmenorrhea, but I did see some anecdotes that it potentially could relax the uterus and cause decreased contractions. I have to say that I haven't really seen this in any kind of head-to-head study, so I don't know, but if certainly you're using a menstrual cup and that seems to help, then go for it.
Right. There's no one fix here.
Absolutely.
Okay, here's one other suggestion that worked for a family, and various other people chiming in about it, that seeing a functional medicine doctor really helped. And that led to like no junk food, really changing the diet. Have you heard about a connection between cramps and diet?
Well, I'm a huge proponent of using alternate medicine as a way to also help young people with any lifestyle related issues. So certainly a functional medicine seems to help. And you've already tried a lot of the other modalities that we talked about. I think it certainly can be something to also incorporate. When it comes to diet and nutrition, I think that in any way that we can optimize nutrition, many young people come to me and they're skipping their meals. They're maybe getting a lot more of food that might be junk food than potentially fruits and vegetables, and getting the calcium in their diet. So trying to, of course, coming back to regular meals and less preservatives, I think is across the board a really wonderful thing to think about. And it shouldn't just be for menstrual cycles, but there certainly is probably some benefit in terms of making sure that you're decreasing that as you're also thinking about pain with periods and inflammation and so on.
But that's not you don't go to that right away as like a solution for cramps.
I don't, because I think there's so many other things to think about, but I do think, of course, coming back to good nutrition and eating healthy and minimizing processed foods is a really good, solution for a lot of things that are out there. So dysmenorrhea, then again, I think it's great.
Okay, so these two things, I don't even know how to pronounce this one, mefenamic acid.
Yes, big word.
And magnesium.
Yes.
Do those do something?
So mefenamic acid also is, I think, a wonderful medication that's out there that we can sometimes prescribe for patients. So in terms of kind of the continuum, a lot of times we'll start with things like nonsteroidals, work up to longer acting nonsteroidals, but mefenamic acid is kind of a cousin of that, and certainly can also be very useful in terms of helping with that prostacyclin release that I mentioned. And I think
over the counter
was magnesium. It is something that needs to be prescribed by your physician. So, but it certainly can be a tool before you get to the contraceptive and hormonal methods that I mentioned that some people are a little bit more leery of using. Other things, magnesium, there's been some thought maybe that there's some low magnesium that can also potentially cause these contractions and pain and other things. So certainly increasing magnesium in the diet. I did read one report that said in the second half of your menstrual cycle from day 15 to say day 28, if you could increase your magnesium, there may be some benefit. Again, some people will find that there's an improvement, others may not. I think overall, it's really hard to get my teenagers sometimes to even do a multivitamin every day, much less take all these other supplements. So it really, I think, depends on the individual.
Okay, my last question is, you go to your doctor and the doctor is telling your daughter that everybody suffers with cramps. What's your response?
This is a really great question. And I actually helped to publish a study which showed that a lot of young people are struggling with pain related to their menstrual cycles and are missing, as I mentioned, school and activities and work. And the short answer is that no one should suffer from these issues. And this is not something that we can just say, it's okay, everyone has this, just go back and do your thing, because it can really, really be debilitating. So I hope that some of the things that we've just shared allow all of the viewers to understand that there's a lot of modalities that they're out there. And if your physician is saying that, you can certainly come back and say, but I heard this interview. And in fact, there's a lot of things out there, or you need to go to another provider that certainly can help you to be able to get through all of this. But there's a lot of treatments. No one should suffer, even if it's mild. There are things that are out there that can certainly help with pain.
I just want to say some of my girls have had that where they've been ignored, diminished, told that like they're complaining about their pain is kind of annoying to the doctor. So I appreciate that. Don't stand with that.
Absolutely. Again, if there's any message that comes out from our discussion today, which is, I think the answer is that really we shouldn't be minimizing these things. These are important. this really causes suffering and pain and is not, something that's really easy for a lot of young people. So being able to get those treatments, being able to understand what needs to happen differently are really important. So have those conversations if you can with your provider.
Okay, we're getting you out just in time. Dr. Anisha Abraham, thank you, thank you.